sir. Today my topic is regarding case study at clinical practice mental health case study. My topic is case study of a young patient with the paranoid schizophrenia. My base in the Psychiatric department of Selayang. So the topic discussion is introduction of the first is introduction of paranoid schizophrenia. Second is information, patient demographic data and the general health history. Number third is information and the documentation on the patient mental health and the assessment finding (MSE). Fourth is discussion on the medical or surgical management of the patient. Fifth is identification of the clinical diagnosis and intervention of the patient. Sixth, conclusion, and seven is finally will be the references. Okay, introduction of a paranoid schizophrenia. Paranoid schizophrenia is defined by the predominantly optimized sign of the schizophrenia. This severe symptom blur the distinction between what is true or and what is not. Schizophrenia exists in about 1.1 of the population of the world. The average age of onset late adolescent in early adult. It's highly unusual for the schizophrenia to be diagnosed after age 45. Is actually according to the Sahid Muhammad and Zulfai and Aliyah in 2018 is a reference. Okay, introduction of the schizophrenia in the causes. Okay, the research suggests that schizophrenia may have several possible causes. First is genetic. Genetic is the risk of the schizophrenia more than 6 times higher if you have a close partner with condition. Schizophrenia not caused by a particular genetic variation. Okay, environment exposed to the virus or the malnutrition before the birth increase the risk of the schizophrenia. Okay, few research indicate between autoimmune disorder and psychosis development are the more factor that involving in the environment. Okay, third is brain chemistry. Schizophrenia may be improved by some brain chemical and including neurotransmitter called dopamine or glutamate. Okay, the final will be substance uses and increased body research show that psychotic episode is raised by the smoking marijuana. Marijuana is considered as a ganja case. The younger and more regular use, the more high risk. Okay, then I'm going to touch about the symptoms. Schizophrenia is early symptom may appear very typical, may be explained by the variety of the other causes. Okay, warning sign of the psychosis may be including seeing, feeling and tasting something that others do not. Okay, display any these of the signs, not generally we can conclude as the schizophrenia, but these are indication of the mental health examination are recommended by the Ministry of Health. If a person is having schizophrenia, okay, early diagnosis is the greater hope to a good result. If early diagnosis and treatment is a really good hope for the recover. So good signs such as paranoia illusions are less likely good to overlooked. Okay, the most frequent movement to seek care during the active period when psychosis frequency cause drastic disruption of the life and live around to other people. Maybe it's cause also disturbance for the others around the patients. When the psychotic frequency causes drastic disruptions, maybe we can detect by the face by face, especially the active phase. When hallucination and vision disturbance to the patient mainly experience unpleasant symptoms. The vast majority their source and effect is the concentrate on the perceivance and defending their mistake perception or distortion of understanding such as vision and hallucinations. Okay, coming to my information on the patient demographic data and general history. So this patient it's quite interesting case. I really know and study the patient, and I can feel it how the patient is really had this kind of symptoms all. Is quite the case also is quite like really pity the girl lah. Actually, the pretty girl. So let's go to the case. Okay, the patient biodata. The patient, his name is unknown. Age is 35 years. Patient is a female. Patient marital status is a patient divorcee. Okay, the race is Chinese. Okay, the admission test is the compulsory admission. Okay, then the patient occupation is a patient at the executive public bank at the Penang. Okay, date of the admission 2nd October 2021. Okay, the referral source is referral made by the emergency department hospital Selayang via the form 3 by medical officer on call psychiatric department. Okay, the language is spoken during the patient, during the history taking, the patient was spoken Malay and English. Chief complaint, aggressive behavior since 1 week, suicidal thought 2 days, angry without the reason for 4 months. Okay, sleep disorder 1 week, lack of the appetite for the 3 days, the patients. Okay, second, history of the present illness. Patient shows not feeling well since 1 week. Okay, isolating herself in the room and talking to herself. Okay, increased activity despite mood poor sleep. Verbally abuse toward to the family members, especially mother and the younger sister. Okay, occasionally talk about burning herself in the with the petrol. This is really like a warm or disaster warning. Then the patient, the patient mother and sister worried and they straight away bring to the emergency department. Okay, list of the complaint and type of the onset, duration and prediction factors and relieving factors and association experience. Okay, patient act unusual since back from the Penang. Since she are working there as an executive, she are working in the Penang, but her hometown is Selayang. Okay, scold her mother and sister at home. Patient has displayed with abnormal behavior since 4 days, verbally abused, irritable, talking and laughing herself. Helpless. Okay, sleep pattern very poor. She really insomnia, very nighttime, very calm. Sometimes the mother from history from the mother, the patient is always on light, always talking until the midnight. The patient keep on talking herself inside the room, her room inside. The mother also don't know what to do, what she is trying to say. So anything, if mother asking also, she don't want to tell her feeling. What's really she going through. The toilet, go to the toilet. The previously patient had a good toilet, good hygiene, but now very poor hygiene. Can see her appearance also. Okay, treatment from the weather, other source. Okay, gastrectomy follow at the Penang Highland Hospital, private, and the family history. Now patient stay with the mother and younger sister. No children previously had a good relationship with the family members before get divorced with the husband. No history of the mental illness among the family members. Information and documentation on the patient's mental history and assessment finding, MSc. Okay, personal history of the patient in the mental health documentation. Childhood, active kids and frequency and the asthma attack. Neurotic problem, no. Academic, the patient really had a strong achievement in the education background. Okay, patient active study at the financing field at the University of Malaysia Sabah UMS in 2000. She has graduated in 2006. Working period, currently patient was working at the Penang Public Bank as an executive position. Sexual experience, patient had divorced with the husband last year. Okay, miscarriage, patient had one-time abortion. Okay, friend and social background, patient had one close friend since childhood. Loss of contact since divorce last year. Because patient, for history from mother, patient purposely avoid the friends and the surrounding about people. Previously mental history, depression, follow at the psychiatric department, hospital general or Penang General Hospital. The MO of the hospital line already contact with the Penang ENT hospital, Penang ENT department to further detail about this case. Okay, general appearance and behavior. Okay, general impression. Okay, patient aggressive and hot temper. High contact is with no eye contact and no cooperation with the healthcare hospital. Especially when I also clerking the case, patient really know how to cooperate with me. Okay, state of conscious but don't know where is she now. Sometimes she don't know she are in the ward or she in the hospital. But really pity because one of the educated girl is lost his life. Okay, physical appearance, tall, white skin color, no physical disability, facial expression and posture. During consultation, patient aggressive and no any facial expression. Reactivity around surroundings. Sometimes cooperate them, sometimes she cooperate, most time not cooperate. Respond with the staff and family members. Sometimes she responds. Okay, mannerism, no any other weird behavior she showed toward doctors and the medical staff in the ENT department or not ENT, psychiatric department or ED department. Okay, talk language is Malay and English. Amount of talk, less communication with the high contact. Rational and relevant coherence. During the communication, there is no rational and relevant speech. Spite of the idea, as patient cannot have accept herself, she in the psychiatric or what, she cannot accept that she is having a mental problem or psychiatric problem. Okay, pressure of the speech, yes, with the anger of pressure, with the healthcare staff, with the family members. Mood, not stable, anger, active response, appropriate, consistent of the mood. Okay, patient mood, no consistently, withdrawal, yeah, withdrawal with the corporate, with the consultations. Okay, thought of consent, dilution and misinterpretation, yes, split off from the reality. Okay, despersonalization, she had feelings, sometimes control your speech or movement. Okay, hypochondria, patient continuous emotionally, cannot forget the past life he had with the husband, ex-husband. Hallucination, having something wise at the night time, feel want to meet the person personally to express a feeling. This is really, I feel like very sad lah. The feeling I have. Preoccupation, main preoccupation was the success in the career and take care of her mother, younger sister. But she seriously, her aim, everything, she want to really success in the career, but unfortunately she meet the bad life. We went to go through the bad life, personal marriage life. They had this kind of finally henna with the psychiatric department. Obsession and phobias, fear with the ex-husband thought. Suicidal thought, most of the times hate herself, cannot accept that her husband scandal with other girls. Repetitive dreams, dream about her ex-husband. Orientation, place, she really cannot recognize, she feels stay at the, she sometimes, most of them she stay like she's staying at the Penang. She like still feel like she has staying the Penang with the working place. Time telling, not accurate timing. Person can recognize a mother and younger sister only. Okay, memory, remote memory. Remote memory means really cannot recall whatever happened after she had divorced with the husband. So her memory really strong. Recall before a man divorce. Okay, immediate memory, she can recognize surrounding close people, only mother and sister. 5-minute memory test. Patient can remember again the things show after 5 minutes, like chair, table and ceiling fan. Okay, 3.7, information and vocabulary. Estimate intelligence level. No any intelligence speech from the patient during the consultation and during the history taking. Okay, abstraction, provost text, she really cooperate on this test. Attention and concentration. No eye contact with all the conversation. Serial 7 test, sometimes patient really answer the question. Digital span, patient able to count 1 until 10. Physical examination, which I go to short lah. Okay, general temperature is 36.7 Celsius. Temperature, pulse rate is 88. Respiration 21. BP is a normal 126/87. Okay, cardiovascular ECG is a normal sinus. Normal apex beat. Respiration system is everything normal. Abdominal soft and tender, no tender around the abdominal region. Central nervous system, access to motor sensory skill normal, hearing and speech, everything normal, vision also normal. Okay, discussion on the medical and surgical management of the patient. To the treatment team, okay, okay, the recovery staff can include nurses, physician and include psychiatric. Social workers and psychological pharmacists are the therapists, can do reactive therapists, dietitian per support workers, spiritual consultant. The task of the care team is to help the patient, especially the psychiatric patient, as well recover plan, collaborate a supportive friendship with the team partner, allow the patient rejoin, recover well-being, is re-engage the activities that are important to them. Okay, medication. Coming to the medication. Antipsychotic are the key treatment or used to relieve the signs of the schizophrenia. Okay, they are also used the combination of the medication for the other sign of the mental well-being, such as mood stabilizer, sedation, and antidepressant, and the drugs that cope with the side effect of the antipsychotic. In the person with the acute psychosis, the drugs can help regulate the symptom and relax and clear the distress within hours or days, but can take up 6 weeks to produce their maximum benefit. Over the longer term, antipsychotic can help avoid more episode psychosis, while they can help most people with the schizophrenia. Antipsychotic can have a severe side effect also. Okay, type of antipsychotic. Antipsychotic medication are generally divided into category. First generation, also typical antipsychotic, and the second and third generation atypical and atypical. Okay, the never second generation atypical. So is like we can few medication main tables we can sclozaril, zizofin, and serozul. And what that is, our tables are very, medication are very helpful to the patient. Okay, discussion. Other than medication, we got to electroconvulsive therapy, ECT. When signs of the schizophrenia are not resolved by the treatment by the medication, so psychiatric and psychiatric specialists go for the treatment for the depression. They go to ECT may recommended. Patient now are given muscle relaxant and general anesthesia until a slide of electric current applied to the one or both sides of the brain. Okay, the personal well-being handle display or outward movement. Okay, the cause of ECT consists variety of procedure that most commonly offered to 3 days a week. 3 days a week patient can go through the ECT. Okay, few people have memory issues following the medication, but this problem typically resolved within a few weeks and few months. We can recover. Then transcranial magnetic stimulation. Transcranial magnetic stimulation is a modern from the therapy that send to magnetic waves to the brain, stimulate the nerves. This treatment will be considered a portion of medicine. Researchers are studying this until now, because this transcranial magnetic stimulation is still under the study, but especially in Malaysia we not yet applied. This already I discussed with my psychiatric department specialist. They say we are Malaysia. Especially in Malaysia, they have not really not come out with this kind of the medication with the treatment. Then psychosocial therapies and support. Psychosocial more to counseling, help the individual develop the recovery skills such as setting and meeting goals, improving the self-care, education, finding a job after the treatment for the patient. At least come out with a new life for the patients. Okay, identification of the clinical diagnosis. Now coming to identification, clinical diagnosis, and the intervention of the patient. Okay, diagnosis. Determinant of the diagnosis of the schizophrenia may include the physical examination. Physical examination, we have to help to rule out the patient problem would be causing symptoms and to check any related complaint. Tests and screening. This may be included tests that help rule out the condition with similar symptoms. Screening for the alcohol, drugs. The doctors may be request imaging studies such as the MRI, CT scan, psychiatric evaluation. A doctor and mental health care professional check the mental status of observation, appearance, and asking about the thought of the delusion, hallucination, substance use, and the potential and for violence and suicide. Also include with the discussion for the family history taken from the patient. Okay. Psychiatric management intervention is a very, very important psychiatric management of intervention. Okay, developing a planned treatment. Proper treatment is very important for the psychiatric supplementation treatment and must be formulated. This procedure involves the selection of treatment model, modelized specific types treatment and treatment setting. Okay, developing a therapeutic alliance and promoting treatment as non-pharmaceutical therapy. For non-pharmaceutical therapy is more to counseling, treatment, how to convert the patient mindset, all that. Okay, pharmacological therapy, when I already explained about more to antipsychotic treatment for the patient, first generation, second generation, third generation, about the treatment to the applied to the patient. Okay, as a conclusion, schizophrenia and other psychotic among the most severe and impairment, severe medical disease is average age onset for the many psychotic disorder is the most critical period in education, occupational and social development. Patients or parents or guidance must instead to manipulate the environment at the home and make the patient surrounding comfortable for the patient. Okay, many research suggests that living environment people with schizophrenia influence their social relationship. People with schizophrenia have the support and social relationship. They have better quality life and fewer symptoms and admission at the hospital. So what I've learned from this case study is like as a conclusion, I really learn and I really learn and understand what is the really problem. So how severe the schizophrenia, paranoid schizophrenia is happened to a patient. Even though the patient is one of the smart girl, educated, but she's failed in the marriage life, is finally end up with the psychotic phobia. So hope I deliver my best speech for my clinical case study on the psychiatric. Thank you, sir.